If you are an employee health and benefits leader for a large hospital or health system and want to totally transform your MSK cost savings approach, then I'm going to share with you the three things you need to do to be successful in 2025 and beyond. My name is Dr. Eric Makhni. I'm a practicing orthopedic surgeon with over 15 years of experience treating MSK conditions in hospital and health system employees, and now delivering that care virtually through a physician-led multidisciplinary approach that drives 4x cost savings for our health system partners and their self-insured employee populations. So if you want to be successful, these are the three things that you need to do in 2025. Number one, understand your MSK problem. Number two, abandon the status quo. And number three, implement an integrated digital approach. Now, one thing to keep in mind that is very important is that employee health matters for hospitals and health systems is very different than those for traditional employers, such as the Amazon, Targets, and Walmarts of the world. The reason is that hospitals and health systems have their own clinical services, physical health, specialty care, mental health, weight loss, and so forth. And so if you are running benefits for your employees and you're from a hospital or health system, and you are using generic benefits and managers and brokers who are giving the same solutions to their other large employers, then you're missing an opportunity to implement a solution that really harnesses the power of your health system and also reduces the redundancies of providing that care. So it's really important that you listen to this video so you can understand how to implement a solution that really is the best approach for your health system and hospital employees. Number one, understand your MSK problem. So if you're watching this video, you probably have a very good understanding that your MSK costs are consistently among the top 5 costs in your self-insured employee population. And it's not just your employer group. It is every employer group across the country. In fact, 1 in 2 of American adults have some form of back or joint pain, and this is what is driving up those costs year in and year out. If you want further validation, take a look at this study from JAMA in 2020 that showed that the top 3 cost drivers are actually number 1, back and neck pain, and then number 2, other joint pain. So MSK conditions comprise 2 of the top 3 cost drivers and are the most expensive, even in front of diabetes. As an employer, you should also know that these costs are going to keep going up year in and year out. And so the question for you becomes, what are you going to do for MSK cost control reduction for 2025 and beyond? Now, you may be saying, I don't know if MSK conditions are a big deal for us or not. I've got no idea, and I don't have access to that data. The health plan does, or our other partner organization does. Well, here's a way that you can figure it out. In the link below and in the comments, we are going to give you a free Excel file with over 1,100 ICD codes that you can give to your health plan partner along with the categories of the top 5 conditions they belong to, and they can give you the data on where those costs fall in relation to other cost conditions. So the question I give to you as a health system or hospital benefits leader is, what are you doing to optimize your MSK care and cost for your valuable self-insured employer population? Are you doing a strategy that optimizes outcomes? If not, then keep listening for how you can change that approach. If you're enjoying this content and want to connect and discuss more how we can help improve the MSK care of your health system employees, feel free to click the link below and schedule some time to chat with either myself or someone from my team. Number 2, abandon the status quo. Historically, hospitals and health systems have not had to worry about MSK care for their self-insured employees for 3 reasons. 1, they already have orthopedic doctors and physical therapists that were available to help take care of these employees. Number 2, MSK costs were not that high on the radar. And number 3, there were no real alternatives to these solutions. So they had to go with their own providers to take care of these employees. Well, all that has changed. And you can no longer rely on that status quo or benign neglect for your MSK care for your health system employees. That status quo is no longer effective in maintaining cost control while delivering high quality care for 5 different reasons. The first, wait times. It can take weeks to get in to see a specialist or physical therapist for back pain or any other joint pain condition. So what happens is that employee either languishes and continues to have symptoms, has to take time off to deal with that symptoms and pain, or will see other providers from different health systems to take care of their condition. This leads to a lot of employee frustration and frustration by the providers, such as the primary care team, when they're trying to help navigate the system for that employee. And when they go see providers from outside the health system or hospital, it's a big problem with leakage where now you're losing those services to competitors in the market. The second reason why the status quo doesn't work is access challenges. Even if the wait time is low, the problem is that the employee still has to take time off work to go to that visit or physical therapy session if they can take the time off work to do so. Traditional physical therapy for somebody with low back pain can be 2 to 3 visits per week, extending up to 6 to 12 weeks per episode. That is a lot of time missed from work, especially when you count the transit time, parking time, and the time at those sessions. What if they don't live near the clinic or the physical therapy practice? Now you force them into the same situation where they either have to languish with their symptoms or seek care from an outside facility, again, potentially going to one of your competitors in the area. Now, you may say, fine, it's just one person going outside the system. The problem is, if that employee has a good experience outside your hospital or health system, guess where that employee's family and friends are going to go? Guess where that employee is going to advertise on social media that they had a great outcome at so-and-so location. And maybe that employee might even leave your health system or hospital to go work at that clinic in your competitor because it looks like a good opportunity. So it's really important to not let these access challenges get in the way when you're trying to provide high quality care to your employees. Number three, primary care overload. If you cannot get rapid access to high quality MSK care for your employees, not only are you going to deal with the issues I just mentioned, but you're now going to overload your already stretched primary care workforce. So here's what's going to happen. The employee's going to have back pain. They're going to message their primary care doctor and say they need a referral to physical therapy. There won't be a physical therapy appointment available for 4 to 6 weeks or one near where they live or at the hours they can accommodate. So what happens is the primary care doctor now has to help navigate that. That means more medications, more tests, more imaging, more referrals to outside systems. And you have this problem where now the primary care doctor is managing things that they don't need to be managing. And you're already compounding a horrible access problem for other patients that need to get into primary care. Now, another thing is primary care is the gateway to revenue for most hospitals and health systems that thrive on the specialty care and the downstream care that comes from a robust primary care network. If you are clogging those primary care visits for employee visits for back pain and joint pain that don't need to happen, you are closing your own funnel as a health system. Number four, specialty care is expensive. So if you are relying on your own specialist to take care of your employees, then you are going to spend a lot of extra money. 90% of joint conditions and back pain do not need to see a specialist. But if that's the only path for your employees, you're going to end up spending that money on not only the specialty care, but everything that comes with it. More injections, more imaging, more surgeries. No matter how you want to look at it, your specialists are compensated in a fee-for-service environment. And so they're used to doing procedures and surgeries, just like I am in the clinic. They're not used to doing preventative care. So if you over-rely on your specialists, you're going to overuse specialty care, very costly specialty care for your employees, which will drive up costs. And then finally, the fifth reason why the status quo doesn't work is going along with all these points is opportunity cost. If you have a self-insured employee with back pain that does not need to see a spine surgeon, but they go see the spine surgeon because they're in the same health system and there's no other option, guess what? That spine surgeon just lost a clinic spot that could have been used for a patient that may have needed surgery that would have benefited the health system from a revenue perspective. And now you've taken up those spots with your internal employees that do not need to see a specialist. So the opportunity cost is a big problem when you over rely on your internal network of specialists when they are not needed for that purpose. So again, all these reasons are why you cannot keep depending on the status quo of sending your employees to the orthopedic and pain and PT providers in your system when they might be able to get managed without needing those specialty visits in the first place. So now, strategy 3 for health system and hospital employers for transforming MSK care. Implement an integrated digital strategy. As you can imagine, you can solve most of the limitations I've presented so far if you have access to a high quality digital solution that will take care of your access problems. It will take care of your cost problems and your quality problems because now you can get your employees the help they need for their MSK condition without waiting for a long time for brick and mortar care, especially through convenient hours that they can do at home or work or during their lunch break. So that's where digital care comes in. Since COVID has taken over back in 2020, we have seen ample data that has shown that digital health is as if not more effective than traditional MSK care for anyone who needs non-operative treatment, which again is 90% of all people with back and joint pain. Okay. So if you are going to put together a digital strategy for your health system employees, you can do it in one of three ways. The first is you could build it yourself. You could create the technology, you could create the content, the exercise program, and the engagement models and deliver it yourself as a health system. However, I will tell you, this will literally cost, and again, from personal experience, millions of dollars putting together the technology, the processes, and the people to execute that system, not only at a high quality, but also to maintain it going forward. And a lot of the partners we've worked with have tried to do that approach, that home built approach, but we're not able to because it's not really the core competency of a health system. The health system is really good at delivering complex in-person care, not a digital health engagement approach. And so you can do that, but you're going to spend far more money building the system and maintaining it than you would if you just partner with a high quality provider of digital care. The second option is you go with what's called a benefits solution. And there's a lot of different digital MSK wellness and benefits programs on the market right now. Many of the larger employers are using these tools. They are basically home exercise programs with supervision of a coach or maybe a physical therapist that will guide the employee or participant through a regimented program for their condition. Now, these programs are great at providing access to exercise treatment, but they're not exactly, clinical grade, meaning there's no providers that are delivering care in real-time, live, synchronous fashion like you would get one-to-one with a physical therapist or another healthcare professional. Typically, it is focused on exercise treatments. You're not getting a lot of care with nutritionists or physician specialists or mental health or pain coping. And also, they're really designed to treat low acuity conditions. So if you have low grade back pain that you never would see a orthopedic surgeon for in the beginning, then you can do this program and get on a home program and do your exercises. So these benefits tools are really good for those purposes, but they don't typically create long-lasting behavior change because they're very limited in duration. Now, you can finish a program like this in a couple of weeks. They tend to be costly because you're paying a lot for very little human interaction. You're paying for the technology. And so for all those reasons, I think these programs are great if you want something quick and easy to implement across the population. But if you're looking for real cost savings, real surgical avoidance, it's just not enough to take care of a health system or a hospital employee population. Now, in our research, we have seen that the typical health system employee actually is less healthy than you would imagine. Over 50% are overweight with a BMI of 30 or higher. Over 50% have had some sort of mental health condition or diagnosis or symptoms of anxiety or depression. And up to 60% have already seen a specialist, like an orthopedic surgeon, for their pain and condition. And so you're dealing with a population that is actually fairly complex with a lot of tough work hours and a lot of comorbidities. And so doing a out-of-the-box solution for a low back pain program will be somewhat effective, but really more so for people who've got low-grade symptoms. And so that is what we call a wellness or benefit solution. The third option you have is to implement a clinical grade solution, ideally one that is integrated. And so let's break that up. First, what is a clinical grade digital solution? That simply means it's a solution that provides the same quality, if not a higher quality care for your employee when compared to what they would receive for outpatient treatment. So that means at the very least, it includes live, synchronous, one-to-one physical therapy sessions, of course, amplified and enhanced with a technology solution to do your home exercise program, but really the core of the treatment is actual physical therapy. Now, the better solutions out there are more comprehensive. That includes multidisciplinary treatment. So a MSK physician that is overseeing the program or providing the initial diagnosis, not only the physical therapist, but other clinicians such as registered dietitians, board certified health coaches to keep you going the program. So it's a team approach that's really well equipped to deal with employees that have multiple comorbidities when it comes to nutrition, mental health, and physical conditions. And so that is a clinical grade program hallmarked by live synchronous care and multidisciplinary modalities. Of course, also you want rigorous outcomes measurement. When you do physical therapy in the ambulatory world, your physical therapist is collecting PROMs or patient reported outcome measures at every visit to make sure you're improving in your function, pain, and mental health. And so the digital solution, if it is clinical grade, is regularly collecting those PROMs as well across your health domains. Now, that's the clinical grade part. What does it mean to be an integrated digital health solution? So as I've mentioned, health systems and hospitals are very different than traditional employers for the basic reason that you have your own healthcare providers, you have your own ancillary services such as mental health, physical therapy, nutrition, weight loss, all those things. And then you also have an EMR. which is the lifeblood of the health system and the hospital. Everything's on the EMR, right? And so that way it allows your employees, many of which whose primary care providers are in the system, to see what's going on when they access those services and clinical programs. To be an integrated digital health solution, you have to fit into the ecosystem of that health system and hospital. And this is how you do it. There's really a few ways that you need to a few things that you need to check off the box. One is you need to be EMR compatible or EMR integrated. That means the digital health solution, when they do care delivery with the employee, they should, because they are a clinical grade team, should actually be able to upload documentation into the EMR that the health systems providers can then see. Also, being EMR integrated allows not only for that document entry, but also to review labs, tests, imaging, and notes to really understand what's going on with that employee if they've already gotten care in that system. And finally, we can put orders in the system as well for those tests, imaging, labs, and x-rays so they can get the care, they can continue to get the care at the health system. And so that's what the EMR component. Secondly, to be integrated, there has to be a direct channel to specialty services, especially in-person services when needed. So for example, if you're taking care of an employee who's got back pain, the pain gets worse and they need to see a surgeon, or they have maybe an injury that would benefit from an orthopedic evaluation, you don't want to just tell them to go see their primary care doctor, because now you're exacerbating that primary care access issue, that overworking issue. And that is what a wellness benefit solution would do. It would say, go see your primary care doctor if you're having worsening pain. If you are an integrated solution, you've already got the referral pathways built in. You can make a referral through that EMR, or you can already pre-program those channels to say, okay, if there is a referral needed, who do we send that employee to get them set up with the right care at the right time? And that is a second hallmark of being an integrated clinical grade solution. The third hallmark is being able to connect to the other services. So here's an example. Let's say you have an employee who is struggling with weight loss and anxiety along with their back pain. Your program, the digital program, if it's clinical grade, will really focus on helping the employee understand what's going on with the back pain, how to treat it from an exercise therapy perspective, how to get some pain coping. But it's not necessarily designed to do the weight loss component or the full mental health component. And so the point is that if it's an integrated solution, it will connect to the health system services. So again, we're not overburdening the primary care doctor and saying, okay, now you got to go see your primary care physician and they'll figure out the mental health and the weight loss concerns. We as a digital health solution can do that. And so taken together, this approach, if in 2025 and onwards, you want to drastically transform and reform your MSK care for your self-insured employees, if you are a leader in a healthcare system or a hospital, then you really need to follow those three rules that I've laid out before you. We are happy to help do so. We do have a clinical grade integrated solution that plugs right into healthcare systems and hospitals, and as mentioned, can drive 4x savings. And we can do so by really functioning within your organization. If that's of interest to you, please click the link below and schedule a demo with myself or someone from my team. But otherwise, we hope that this is helpful. And I think that if you follow these three key steps, you're going to be really surprised at how well and how effective this program can work in your institution.